I invite you all to imagine with me for a moment. Picture a hospital room. When I do this, I see a patient room within an ER. There's a bed, a computer, typical tools like a blood pressure cuff and an otoscope. The lighting is a little harsh. For most of us, the hospital room you pictured probably looks something like this. And I bet that the last time you were on the way to the hospital, whether seeking care for yourself or a loved one, or providing that care, you weren't wondering if, when you arrived, the facility would have electricity. But for many, this is reality. The facility they rely on for essential healthcare services does not have electricity or experiences unpredictable power grid failures. Non-electrified healthcare means that advanced diagnostic tools like medical imaging or life-saving treatments like mechanical ventilation are not practical. Equipment used to continuously monitor a patient's health is unavailable, communication and documentation become increasingly difficult, and having refrigerated medications or vaccines is simply not an option. Unfairly, this means the greatest innovations to improve human health of the past decades are not at the disposal of the healthcare workers nor accessible to the patients. Perhaps most importantly, however, limited to no electricity in health clinics means there is no modern lighting. The very thing that allows health professionals to more closely examine the wound on a patient's leg, to perform a safe procedure, or to simply work past the daylight hours becomes a potentially dangerous endeavor. Without modern lighting, clinics resort to more accessible forms of light, like kerosene lamps, candles, or flashlights. Though I wish it were, this is not an exaggeration. 1 billion people receive healthcare in a facility completely without electricity. Even more receive healthcare at a facility with unreliable electricity. And thanks to climate change, even more people yet will fall into this category in the coming decades as we experience an increasing number of adverse weather events. For the greater than 1 in 8 people who face this reality, the consequences of non-electrified healthcare are inconvenient at best and fatal at worst. In fact, when clinics don't have access to reliable electricity, there are serious health implications for their communities, including increased mortality, higher incidence of disease, and overall poorer population health. And like almost everything, the world's countries aren't bearing this burden equally. The crisis is largely affecting low and middle income countries where poor health and inability to access appropriate care compound on other fragile systems and reinforce the inequities that maintain countries' current positionings on the scale of economic and social development. So what can be done? We propose a vehicle to microgrid system. Let's break that down. A microgrid is a localized, standalone energy system that typically uses one or more renewable energy sources to supply power to only a small group of loads. Such systems reduce facility susceptibility to traditional power grid failures and provide them with the autonomy to establish custom operational structures. Electric vehicles have been proposed as an additional tool to increase resiliency of microgrids. The very basic idea is that the vehicle batteries can be used to supply backup power to the facility during outages or times of high demand, and are charged on the same system during optimal conditions. In our case, we are interested in micromobility specifically, which just refers to smaller, more lightweight vehicles like electric bicycles and electric motorbikes. The bikes can be leveraged to provide a wide range of services beyond improving microgrid reliability, shown here. And the motivation for using bikes and motorbikes in particular versus electric cars is that they have already proven to be effective tools for health delivery in rural or resource limited settings. Right now, we are in the final preparatory stages for a local pilot in partnership with the student organization FH King Students for Sustainable Agriculture. They have provided us space on their farm to host a scaled version of the system, allowing us to collect operational data that will inform future models, as well as vet and improve the more novel aspects of the system prior to applying it in a global health setting. At the end of the harvest season, we will be transitioning to the modeling phase of the project, where we will employ a combination of optimization and machine learning techniques to uncover the optimal design of the vehicle to microgrid system. And lastly, we hope to parlay the results of the pilot project to obtain funding and secure a partnership with an interested health clinic for the remainder of the work. Overall, we believe that improving both human and environmental health via clean health clinic electrification will not only turn this into this, but also increase clinics' operational capacity, help retain skilled employees in rural areas, increase patient confidence in the health system, and therefore increase utilization of the health system. All major impacts that result from the proposed micro solutions. Thank you.